All right, we are here at the University of Miami ALS Center. It is a beautiful day, and I can't wait to show Billy the Marlin all about all the great things they do here at the ALS Center. You ready to rock? Let's go! Dr. Benatar, thank you so much for taking the time to talk about ALS and all the great things you're doing here. First of all, I don't think a lot of people know what ALS is, so could you give an explanation and a definition of what ALS is for the people?
Sure, so ALS is an acronym, stands for amyotrophic lateral sclerosis. That's something of a mouthful, so hence ALS. At its core, it's a degenerative disorder, a neurodegenerative disorder. So what that means is neurons are getting sick, nerve cells are getting sick and dying. And what that leads to is progressive weakness. And it's progressive weakness of arms, legs, talking muscles, breathing muscles, and so really leads to progressive loss of function over time.
And this is also known as Lou Gehrig's disease. Of course, with Lou Gehrig Day in baseball, it's important for people to understand that this is a disease that Lou Gehrig had 80 years ago, and someone who was known as the Iron Man, the Iron Horse in baseball. It hits many different people, right? It's not just athletes, it's not just women or men. It hits all different kinds of people and backgrounds too, right?
That's absolutely right. And the age of onset can vary enormously. It's unusual to see in the teenage years, but it's possible. It's unusual to see in the 80s and 90s, but it's possible. But most commonly, it's striking people in the primes of their lives.
Why is it considered a rare disease if it seems like the prevalence is a lot higher than
it's
a rare designation?
It's a great question. The reason it's rare is because we don't have good treatments, and so people die from the disease, and unfortunately, quickly.
Yeah, when my mother was diagnosed with ALS, it was a really brutal process of going from a whole battery of tests that didn't seem to be very diagnostic. Like, it's not like she could take a blood test and say, hey, you have ALS. Why is that? Why is it so hard for patients to be diagnosed with ALS?
Gosh, I think there's so many layers to that question. I think the one is that we do lack a diagnostic test, so it's not easy. It requires somebody to think about it, and it requires good clinical judgment and an ability to discern the things that it's not, and then to recognize it for what it is. And because of the lethality of the diagnosis, many people, even many neurologists, are uncomfortable making it or communicating it. No one wants to do it unless they're absolutely certain, hence often multiple referrals. But lots of things can look like ALS early on, can be confused with many things, and so it's easy for people to get lost in the medical system.
So why is research so important to ALS and finding treatments, finding a cure? What are the type of work you do here?
So the nature of an ALS clinic is that it's multidisciplinary. So what we want to do is we want to bring all the providers that somebody needs to the patient, as opposed to the patient has to go to the neurologist and the physical therapist and the occupational therapist, right? So we bring everybody together.
Yes.
So when patients come and spend time in our clinic, they spend 3 or 4 hours with us.
So why is research important? I think it's the only hope, right? If we don't research the disease, understand it better, and based on that understanding, work to develop meaningfully effective treatments, we're going to continue to face the prospect of providing supportive care for people without an ability to meaningfully impact it. So a lot of what we think about here is, why have we been so singularly unsuccessful in developing effective therapies, and what can we do to change that?
So patients with ALS, when they participate in research, they come into a space like this, a human subjects lab, what's called a dry lab as opposed to a wet lab. We have some electrical machinery equipment here. This is an EMG machine that allows us to record electrical activity from nerves and muscle. We can even use it to look at some signaling from the brain that's controlling nerve and muscle. So patients come and spend a few hours or sometimes a few days with us getting tested. We might do a spinal tap, collect spinal fluid. There's some tubes here. We collect blood. That'll go over to the lab for our work that's done in the lab. But a lot of the work happens here.
Bucket Challenge in 2014, I think I did. And of course, I had no idea that my mom would be diagnosed with ALS. but I found myself doing the Ice Bucket Challenge without really knowing what I was doing it for. I knew that it was for ALS. I didn't quite understand what that disease meant. So how do we tackle that? The awareness of what the disease is itself. I ate peppers and all these things to drive awareness to this disease. But as a doctor who spends his life trying to solve this problem, what is it that we're missing? Like, how do we get the word out more, in your opinion?
Yeah, I think it's hard. Let's just acknowledge that up front. It's hard because it is uncommon. Only 2 per 100,000 people in the population will develop ALS in a year. So think about the primary care doctor who's seeing patients who present with twitching, with weakness. They're going to think about carpal tunnel, a pinched nerve in your back, a pinched nerve in your neck. They're going to think about all sorts of other things. And because those things are much more common, more often that's going to be right? So we have to find ways to educate, but I think it's not just educating primary care doctors and neurologists, but I think it's also the public.
So, Dr. Benatar, what are the interesting or things you're most excited about the work you're doing here?
Yeah, so we've had a long-standing concern that treatment in this disease comes too late. That you could have very good treatments, but you're bringing them to bear, we are bringing them to bear too late. So we've set about trying to understand how does ALS begin and when does it begin? And so the way we did this when we started this 15 years ago more, is we started with families in which ALS occurs and we could find the gene. And then we could take family members who carry that gene that puts them at risk, and we can study them before the disease ever develops, and we can understand those earliest manifestations of disease. And through that, we've developed biomarkers. We haven't spoken about that. We can if you want to. And those biomarkers can predict when disease is coming. And so now the culmination of that work is we are now giving a treatment in a clinical trial, a gene therapy to people before they develop disease in the hope of either preventing it, would be fantastic, or at the very least prolonging it and pushing it out. And the idea is if we can get in super early, can we really make the difference?
I can't tell you how fortunate we would be if we could know 20 years ago instead of 2017, 1997 or 2007 that my mom had a predisposition or a biomarker or something that could signal that this was going to happen. I think she'd spend more time with her grandkids or just be able to have meetings with doctors before to say, what do I need to know about this disease and how do I prevent a fast progression or what are the things I can do to tackle this?
Or how do I get into a clinical trial super early when those drugs are going to be most likely to have a benefit? Exactly. So as in all of medicine, prevention is better than a cure, right? If we can get in early, the earlier we get in, the better the treatment. In ALS, we have a long history of trials that didn't yield a benefit. They didn't meaningfully affect the disease, but we didn't learn why not. And so that makes it harder for the next trial to be a better trial. So I want more trials, but more than more trials, I want better trials. Trials that are informed by a real understanding of the biology of the disease and targeting the right treatment to the right patient, right? The B12 to the B12 deficient patient, the iron to the iron deficient patient. Because if you mix those up, you could have a great treatment, but give it to the wrong person, it's not going to work.
So what does Lou Gehrig Day mean to you?
Well, I think it's about raising awareness, and that has, I think, many important consequences or effects. So the one is greater awareness means more people in society will think about this if they have symptoms, maybe help us get to earlier diagnoses. But one of the biggest barriers to research is funding, to support research.
Well, we're certainly trying. We're doing this together, and it takes a whole village to do this. I really do believe that raising awareness that will lead to more research and funding for scientific studies. And we need more of that. And it really does start with things like this, where we raise awareness for people who did not know what ALS is and how they can help. So wrapping up here, how do people watching this, how can they take part in the eventual cures and treatments for ALS?
So everybody can participate. I'm a firm believer that every and any patient with ALS who wants to be in a research study should be. Now, not everybody can be in a clinical trial because there may be stricter eligibility criteria, but it could be a genetic study, a biomarker study, a medical health record study where we look at data in urine, anything, right? So everybody should be able to contribute. But when we're doing biomarker development, we need healthy controls. I have to tell you, we struggle to recruit healthy controls. Recruiting patients to with ALS is easy. We need vast segments of the community who are well and healthy to also participate in research, because we need the contrast and we need to be able to learn what's normal so we can understand what's abnormal. Family members of people with ALS can also contribute. So everybody is welcome, and it would be valued.
Well, Dr. Benatar, I want to thank you for taking the time here to discuss ALS and many ways that we can combat this disease and ultimately find treatments and cures for ALS. Thank you.
Thank you.